Hello, friends. My name is Jackie Hastings, and I'm a Sapphire Brand Ambassador with Plexus. However, prior to Plexus, I earned a bachelor's. My name is Jack. Got that echo. A bachelor's of health science, a bachelor's of biology, and a doctorate in physical therapy. In my practice, as well as in everyday life, I have seen the connection between gut health and stress. Frankly, I've lived it. I was always the kid with a nervous stomach, always having tummy issues, always upset. Stress manifested itself in many ways in my life, as well as some health issues that were pretty uncomfortable, to say the least. There were days of tummy troubles and head troubles in more ways than one. These things have changed dramatically for me in the past 6 years while I've been using Plexus. But why or how? I'm pulling out my science nerd hat here a bit and digging into some information that I hopefully you will find helpful, or that you will find helpful for someone that you know. Stress, we all have it. We all deal with it differently. When stressed, we engage the fight or flight system. This is the fight or flight response that a lot of us have heard about. We need this in a primitive way to help protect us and allow us to escape from a dangerous situation. However, when we stay stressed, it stresses out our system. It leads to elevated cortisol levels and can have an impact on our gut. Many people will call this leaky gut, meaning that the gaps in between that one cell level in your gut, the lining of your gut, start to widen. When this happens, it allows food particles, bacteria, and toxins from your bacteria or from your gut to enter into the bloodstream. They don't belong there. When this happens, our immune system reacts with inflammatory immune cells. That's what it's supposed to do. They're there to protect us. However, these then get swept into our bloodstream, resulting in full body inflammation. If this happens on a regular basis, it can result in chronic inflammation, which is one of the main causes of chronic pain for people. Then what do? You add in medications such as anti-inflammatories or pain medications that decrease pain and inflammation, but these come at a cost as well. They slow digestion, they increase irritation on the stomach lining, and have further negative effects on the kidney and liver. This means less effective cleansing of the blood, more toxins, more inflammation, more fluid retentions, and this whole cycle is perpetuated. So your stomach hurts and you take meds for your stomach. These disrupt other balances with the absorption of vitamin and minerals. They also change the pH in your stomach, impacting the acid levels in your stomach. You don't digest your food as well, and your tummy troubles continue. Stress also changes the microbiome, the gut bacteria that are important for our health within our whole system. With stress, the good and bad bacteria ratios change, and this is known as dysbiosis. This creates inflammation in the gut that we talked about a little bit ago with that leaky gut syndrome. It also contributes to things such as irritable bowel syndrome, diarrhea, and constipation. One thing I didn't really think about is how stress shuts off digestion. In the fight or flight, which is called the sympathetic nervous system response, blood is directed to where you need it, in your heart, your brain, your lungs, your muscles, but away from digestion. This slows the movement of food in the digestive tract, thus leading to constipation and fermentation, which results in gas, bloating, and abdominal pain. Interestingly enough, stress can also have another effect where it speeds up gut motility in the large intestine and then results in diarrhea. So stress can impact your gut in so many different ways. The sympathetic nervous system doesn't just shut off when you're stressed. It has a really difficult time determining whether that threat is a real threat or if it's just a stressful situation. We need to work on calming that system down, thus activating the parasympathetic nervous system, which is also called the rest and digest system. The parasympathetic nervous system is responsible for things like balancing blood sugar levels, producing relaxation hormones, decreasing blood pressure, heart, and breathing rates, stimulating the flow of saliva, contracting the bladder to stimulate urination, constricting blood vessels and pupils, facilitating gastric secretions, and intestinal movement, allowing digestion to occur, and facilitation of secretion of tears. So when you're stressed, you know how you get that dry mouth, your heart racing, your blood pressure, all these things going on. We need to calm that down with activation of the parasympathetic nervous system. So how in the world do we do this? We need this parasympathetic nervous system to be working correctly in order for our gut to work correctly. How? A few simple tricks. Pausing to take a few slow breaths can help disrupt the stress response. If you've had a stressful day at work or at home or whatever, and you go to sit down and have a meal, pause. Take a few deep breaths in through the nose, out through the mouth, especially is helpful. And that can help calm those systems and allow you to digest your food much more efficiently. Eating in a calm environment. You don't rush out, scarf your food down, eat it quickly. That is bad for your digestion. It's bad because it does not allow your parasympathetic nervous system to kick in. Tapping. This is one that some people have heard about, not everybody has. Tapping on certain points of the body by repeating certain phrases helps some people decrease the stress response. Research has shown that it can reduce the stress hormone cortisol levels by up to 43%, as well as reduce stressors such as depression, anxiety, pain, and psychological distress. I encourage you to look this technique up on your own. It's a nice non-drug alternative. All it is simple tapping and phrases. Hypnotherapy or hypnosis has been helpful, and vagus nerve support. Things like yoga, breathing exercises, and meditation definitely help with that. Supplements can also be helpful for mediating stress and improving your digestion. For example, maintaining the correct balance of microbiomes in the gut through probiotic use. With sufficient quantities, probiotics can improve the intestinal tract's balance of flora. They can increase or decrease the synthesis of certain neurotransmitters and biologically active factors such as serotonin, brain-derived neurotrophic factors, and cortisol, thereby decreasing perceived stress levels. Probiotics can also be called psychobiotics. It's a newer term out there because they have a positive role in mood, cognition, and other psychological processes. What are some other supplements that can be helpful in managing stress? Magnesium. This is one that I was using prior to starting Plexus because I had read about some of these benefits. I do run a little bit difficult on my concentration, some anxiety levels. I was not a great sleeper. The American diet tends to be really high in sodium, calcium, protein, other things like caffeine, alcohol, and medications like proton pump inhibitors. Those are used for those stomach issues, diuretics, antibiotics, and even birth control or hormones can change a whole lot of different things in your stomach. These lower magnesium retention. In healthy people, other situations such as pregnancy, menopause, and aging are also associated with changes in the magnesium needs of our bodies. People with conditions such as diabetes, kidney issues, and stress also have decreased magnesium loss or poor absorption. So if you're not getting enough of magnesium, you have some different issues happening, such as magnesium is needed to create neurotransmitters. And for those neurotransmitters, those nerves, those pathways in your brain and throughout your body, that little electrical wiring system to actually work correctly. It also acts on the pituitary and adrenal levels. It is important in modulating the release of ACTH. I know these are science things, right? But that's a hormone that stimulates cortisol or the stress hormone. So if you don't have the right balance of magnesium to keep that from going crazy, your cortisol levels jump up. That's pretty easy to understand. Magnesium is a micromineral required for hundreds of the body's biochemical reactions, including protein synthesis, muscle and nerve function, blood glucose control, bone development, DNA synthesis, and glutathione synthesis. It also helps keep excitatory transmitters within appropriate limits by inhibiting other receptors, including NMDA. It also supports the calming actions of GABA interacting with its receptor. These are different hormones and other things that other pharmacological agents, like your SSRIs, all of those different things impact in order to help with different stress and anxiety and depression levels. It's interesting that we can do some of these options and have an impact on these processes with a simple micronutrient, micromineral. It's estimated that 50% of Americans of all ages have inadequate intake of magnesium. Symptoms such as irritability, difficulty with concentration, insomnia, depression, and anxiety are associated with this. Another study also found that up to 95% of people with ADHD are deficient in magnesium. The other thing, when we're taking magnesium, what we're taking it with matters. If we're binding it, if we're taking it with calcium, so if we're having a cup of coffee, taking our magnesium pills, yogurt, any of those things, green leafy vegetables, those bind with that magnesium and impair its absorption. So a lot of times people will be taking above the RDA of magnesium. However, when we have high sugar levels, calcium, all of those different things, we're not actually absorbing as much magnesium as we're taking in. So that's a question that I have a lot of people ask sometimes is, why would I take more than the RDA of this? Other things that are helpful, omegas. These are really big in a lot of ways for heart health and so many different things. Specifically, omega-3 is important due to its anti-inflammatory effect. We talked about the amount of inflammation we have in our gut with that leaky gut. Omegas block prostaglandins, which are also involved in the cramps we get and changes in bowel habits around our menstrual cycles, including diarrhea. This is really important for people, especially who have things like PCOS or endometriosis, which we have all of that stuff in that area near our gut, all of that leaking, all of that irritation, and it's a compounding effect. If we can decrease some of that inflammation, it really makes a difference. If we can decrease some of those prostaglandins, we don't have as many of those symptoms. If we can do it without other pharmacological agents that increase the leakiness in our gut, we feel a lot better. Nobody feels good when they're cramping, having diarrhea, and having all of those issues going on. Omegas are also important in our body's levels of melatonin, which is helpful for us getting to sleep. Sleep definitely makes a difference. How do you feel when you haven't rested well? L-theanine. This one helps with mental clarity and focus as it's a precursor to serotonin, which acts as a carrier between nerve cells in the brain throughout your body. So if you've got all of these different things going on, but you've got no way to get it to different places, that's a problem. This plays a key role in mood, sleep, digestion, nausea, wound healing, bone health, and clotting, and even libido, guys and gals. Another supplement that is helpful is collagen. Collagen helps restore these bridges and decrease space between that cell lining in the gut, decreasing that leaky gut. If we can restore that, bring those pathways together or those cells together more, we have less stuff leaking out. This decreases the leaky gut and the inflammatory cycle that results because of it. The more we can do to improve our gut health, the more we can improve our stress levels, which keeps either a positive or a negative cycle going to either improve or deteriorate our physical, mental, and emotional well-being. Some of the different supplements with Plexus that we have available are Probio 5 that has the digestive enzymes in there. It has the probiotics. We have Vital Biome, which has probiotics that have been specifically linked to improving things with anxiety, stress, depression. Couple that with your Slim microbiome activating to get the right prebiotics in there. You've got a really good program going there. Slim hunger control helps with blood sugar levels. It helps with cravings, keeping those blood sugar levels better under control, and the fiber in there helps with better digestion, which again will help with our stress levels and our gut health. Omega X has plant-based omegas in there, so we don't have to worry about adding heavy metals into our system, or fish burps, That's embarrassing. That does not help our stress level. Collagen peptides, we have that in there as well. Edge contains the L-theanine, so it is active. And all of these are really helpful tools that we can have in our box. Having more tools in our bucket allows us to take better control of our health, gut and head. A feeling of control over your body in situations that are sometimes out of your control can definitely impact your outcome in the short and long term. I encourage you to ask whomever invited you here or shared this link with you to help you with the correct supplements and techniques to help your needs while you work on other factors to help you and others live your best lives. Thank you for allowing me the opportunity to talk to you. I hope that you have a good gut and a good stress level and a better life. Have a good night.